Health Watch, drug overdoses have been surging across the U.S., and health experts say the pandemic is at least partly to blame. Drug overdose deaths increased by more than 18% between June 2019 and May 2020, according to the most recent CDC data. During that time period, the highest acceleration of drug overdoses occurred between March and May. Some of the nation's strictest lockdowns were enforced during those months. Many Americans lost loved ones, and millions lost their jobs and financial stability. For more on this, I want to bring in clinical psychologist Dr. Geri-Lynn Utter. Dr. Utter, welcome. Thanks very much for being with us. We mentioned some of the statistics. I wonder, what have you actually seen in your practice? How has the pandemic impacted your work and the patients you see?
Yeah, so since the surgence of the pandemic, I've seen a significant increase in drug and alcohol relapse. So I like to work with people who struggle with substance use disorders in conjunction with other mental health issues. And prior to the pandemic, there was still relapse and people were struggling. But since the pandemic has hit, there's been such an increase or exacerbation in feelings of isolation, depression, anxiety that's related to external factors that are out of a lot of folks' control. So job loss, the grief of the life that they had, the inability to engage other sober supports in a meaningful way, but in an in-person type of atmosphere. And that, in conjunction with those external factors, have really led to a significant increase in relapse, because substance use disorder sometimes is a symptom of deeper mental health issues like depression, anxiety, and trauma that often aren't being addressed.
And you touched on this, doctor, that access to mental health care has been limited during the pandemic. What have been some of the barriers and the effects of that? And could that be contributing to drug overdose deaths?
So as far as access is concerned, what I've seen is more difficulty for individuals to get into inpatient rehabilitation centers. And a lot of that is due to new assessments that have to take place from a physical standpoint to make sure that folks are not, testing positive for COVID when they're going to be admitted into an inpatient type of setting. And if folks are not taken care of and appropriately monitored and treated appropriately during that assessment process, then they can go into opioid withdrawal, and that is a trigger for them. It's difficult. You feel very sick when you go through withdrawal, and if you're waiting for days on end to get an assessment to go inpatient, you end up leaving, because the physical withdrawal is so intense and you're trying and you're not being successful. So you leave and you go out and you continue to use. And I've seen that too much. And it's heart-wrenching and it's heartbreaking. And I think as a treatment community, we have to do a better job of getting folks access to treatment when they are ready to get that treatment.
So the CDC says that synthetic opioids have been driving overdose deaths. The opioid epidemic was, of course, an issue before the pandemic. How do you think, doctor, the U.S. can better address this?
So what we're seeing is novel in that illicitly manufactured fentanyl and other synthetic opioids have flooded the U.S. as far as the opioid epidemic is concerned. And, we've been seeing this a lot over the past 5 or 6 years. But what I keep seeing in clinical practice is folks are being exposed to fentanyl when they want to buy something like heroin. And they're also being exposed via counterfeit pills. So it's a very big concern for me, because if folks are looking for Percocet, or if they're looking for, hydrocodone, and they think that's what they're getting, but in essence, they're getting a counterfeit pill that's fentanyl pressed, that's also driving up the overdose deaths, because they have built a tolerance to a pill that they think they're getting. And it's actually counterfeited with something else, with another synthetic opioid, and those folks are overdosing. So yes, is it terrible that people are still out there seeking, prescription opioids or seeking heroin? Yes, it's sad. But what's even scarier is what they think they're getting, they're not. and they're being exposed inadvertently to fentanyl and they're dying. So it's frightening. And I think what we can do better as a treatment society is to really start to look at synthetic opioids and start to look at the deaths related to that and screen for them on urinary drug screens ahead of time so that we know what we're getting into as far as being able to adequately treat the patient with medication-assisted treatment.
You know, doctor, obviously this conversation is not a substitute for any kind of professional help, but I wonder if there are people who are listening who are struggling with addiction. What are some ways that they can better cope during this difficult time?
Pick up the phone. Reach out to people, talk to people, but the people that you reach out to, talk to people who are sober and who and will offer you the support and the time that you need, and maybe the encouragement and the empowerment to believe in yourself. Believe that you're worth it. I don't care if you've relapsed 100 times. Maybe it's the 101 time that's going to help you get on that right track and get the help that you need. Don't be afraid to reach out to sober supports. Don't be afraid to reach out to digital platforms where you can participate in 12-step fellowship meetings or even sober support groups as a way to kind of empower you and motivate you, and just know that you're worth it.
And for family members as well who, may have loved ones who are struggling with addiction and are really having a difficult time in the middle of this pandemic, are there things they can do as well?
Yeah, I think a great bit of advice that I would give a family member is you cannot take credit for your loved one's recovery, just like you cannot bear the burden of their addiction. So meet them where they are in their recovery journey. If they're ready to get help and they're willing to get help, be there to support them. But if they're not ready and they're coming up with excuses and they're still actively using, know that it's not your responsibility to force them into treatment. You have to meet individuals where they are. You have to support them when they're ready, and just remind them that when they are ready, that you're going to be there. You have to want it. As somebody who struggles with addiction, you have to want it if you're going to accept and be open to the help. So don't feel like it's your burden, but be there for them when they are ready. And also get therapy yourself. Reach out to a therapist so you can talk about how it's impacting you. Participate in Nar-Anon or Al-Anon. Participate in 12-step groups that are for family members who struggle or who have a loved one who struggles with addiction, because it's a great support for yourself because they understand where you're coming from.
Some really important messages here as this crisis within a crisis continues. Dr. Geri-Lynn Utter. Doctor, thank you so much for sharing your expertise and your insights with us.
Thank you so much.